This is Michael Jaffer, Viva 365, joined by John Kaufman, Ken Rosenfield, John Laird. John, you and I have worked together a long time. We've seen lots of things come and go. I'm going to predict you won't be putting many renal artery stents in for atherosclerosis much longer.
The reality is I'm not putting many renal stents in for atherosclerosis in the present. But there are patients that do benefit, no question. And I still think it's a useful procedure for a limited subset of these patients.
Kenny, you worked on the CORAL trial since its earliest days. Why didn't it teach us more than what we learned?
I think there are a lot of issues with the trial. We at our center had great difficulty enrolling the trial. I'm not sure it enrolled the right patients. I'm not sure that we learned everything we need to learn about renal artery stenosis from it. In fact, I'm sure we didn't. And I agree with John. There are a lot of patients that will really benefit from this treatment. Problem is, you got to do it the right way, experienced operators, careful, and with the right technology.
John, you've been a leader in SIR and around the world for renal artery intervention and vascular intervention. Is this field really dead? Are there ways for us to salvage anything about this?
You know, I think the comments from John and Kenny, knowing there are patients out there, we all have this feeling there are patients out there, but it's the same problem as with other areas. How do you identify them and figure that out? So to say, is it dead? No. Is it going to be as widely applied as we had hoped? Probably not at all. We haven't done one probably in about a year as well. Medicines are getting better. I think it's just the disease state is changing and our treatment is changing, but we all have that same feeling. There's a kernel in there, there's a nut in there, and we just got to find it.